Hello, my name is Dan Skief. I'm a Maryville University nurse practitioner student. This is my head-to-toe assessment for Class 612, Advanced Health Assessment. This is my patient, Megan. She's going to be assisting me today. So before she came in, I had her empty her bladder. We did a full set of vital signs. We checked her height, we checked her weight. I tested her far vision with a Snellen chart, and I tested her near vision with a Rosenbaum chart. Okay, so when I'm first observing the patient, I start by looking at her skin. I want to make sure it's uniform throughout, that it's symmetrical. I'm going to make sure there's no wounds or lesions that are visible. I want to look at her eyes, make sure that they're in line. I want to make sure they're symmetrical. And I want to look at her ears, check for symmetry there as well, that the skin is okay over them. There's no wounds or lesions. I want to look at her skull. I'm looking at the shape. I'm looking for any contours, any masses or wounds that I can see up there just with the naked eye. I don't see any. Next, I'm going to move on to testing some cranial nerves. Can you stick your tongue out for me? Can you puff up your cheeks? Crunch down your eyes? Wrinkle your forehead? And smile? And grit your teeth. All right, no problem there. Next, we're going to do some light sensation on the face. So just tell me if you feel this evenly throughout.
Yep. Yes.
All right. Now we're going to palpate the skull. Again, I want to make sure that I don't feel any contours. I don't feel any masses. Also, while I'm palpating, I'm feeling for the hair. I'm making sure it's not coarse, it's not thin. I want to see that it's growing in symmetrically, that there's no areas that are missing any hairs, and there are none. Next, I'm going to move on to palpation of the face. I'm going to palpate all the facial bones. Is there any pain or tenderness when I do that?
No.
Then I want to palpate the sinuses, the frontal and the maxillary.
Mm-hmm.
I'm feeling for any masses or edema. And did you feel any tenderness when I did that? All right. Last thing I want to palpate for in the face right now is TMJ. So maybe open your and close your mouth. I'm feeling for any clicking. I don't feel any of that. And do you have any pain when you're doing that?
No.
Okay. Next, we're going to move on to the eyes. So I start just by inspecting the eyeballs. Make sure that everything is symmetrical. Make sure that the eyebrows are symmetrical. And to make sure the eyelashes are pointed out. Everything looks good there. Next on the eyes, I want to palpate the lacrimal duct. So you can close your eyes for me and just tell me if you feel any pain.
No.
Okay. Also, while I'm looking at the eyes, I'm looking for the sclera, making sure that it's white. There's no jaundice or yellowing of any kind. And then I want to look at the conjunctiva, make sure that it's pink and moist. I'm just going to pull down a little bit. Okay. Next, I'm going to use pen light here to make sure her pupils are equal and reactive. You can just stare straight ahead for me and point on the wall. Come over. And I'm going to come over the other side. Okay, both of them are equal, reactive. And then we're going to look for the light reflex. So for this, you can just stare straight ahead. I'm just going to bring the light up. All right, and I can see the light reflex in both eyes. While we're working on the eyes, we're going to go through the cardinal gazes. So I'll be checking cranial nerves 3, 4, and 6. I want you to follow the pen with your eyes. Just don't move your head. Very good. Then we're going to do the cover and the uncover test. So if you would, cover up your left eye for me with your hand. Okay, uncover that one. We're looking for the adjustment. Now cover up the right eye. Very good, and uncover that. Perfect. After that, we're going to move on to the ears. So with the ears, we just kind of inspect them first. There's no kind of wounds or masses. Skin looks good. There's no discharge coming out of the ears. So we start by palpating the auricle. Is there any tenderness there?
No.
And check the other side. Any tenderness there?
No.
Next for the ears, we're going to do a couple tests. First, we're going to start off with using the tuning fork. I'm going to strike the tuning fork and place it on top of your head. I want you to let me know if you hear it in both ears equally or one more than the other.
Equally.
Okay, now we're going to take the tuning fork and place it on your mastoid process. I want you to tell me when you stop hearing it.
No.
And we'll put it next to you. Tell me when you stop hearing it again.
No.
And do the same thing over here.
No.
The last hearing test we're going to do is going to be the whisper test. So if you cover up your left ear for me, I'm going to step behind you. I'm going to whisper something and you repeat it back.
Baseball.
Okay. And do the same thing here. Cover up your right ear. Football.
Football.
Very good. Okay. Now we're focused on the nose. So we want to start with inspecting the nose. We want to make sure that it's midline. The skin looks good over the top of it. It does. Going to make sure there's no polyps of any kind. Going to make sure that the turbinates are moist. They're pink. Check with the light just in case. Very good. You also want to check for patency. So place your finger on your left nostril for me and blow out your right side. And do the same thing on the other nostril. Perfect. Any problems with that?
No.
Okay. I think so we're going to move on to the mouth. So we're just going to start by looking at the mouth, looking at the lips. They're full pink. You don't see any bluing or discoloration. There's no fissures at the corners. So we'll have you open your mouth up and say ah for me.
Ah.
Very good. We're going to look back in the mouth. We're going to look at the teeth, make sure there's no discoloration. There's no lesions, no sores inside the mouth. Next, we'll have you move your tongue out and have it touch the roof of your mouth. So the same thing, you're going to look underneath the tongue. No signs of any oral cancer of any kind. Then you have to move your tongue from side to side. Very good. All right. So now continuing the mouth, we're going to use the tongue depressor. Go ahead and stick out your tongue. And we're going to test for the gag reflex. This may be a little uncomfortable. Very good. All right. And before we move on to the neck, I just want to test your peripheral vision. So I'm going to put my hands behind you. Tell me when you see my fingers.
Now.
Same thing?
Now.
And one more time. Perfect. All right. So when we start with the neck, same thing. We start with inspection. We look at the skin, make sure it's even. There's no rashes, no lumps, no goiters, nothing like that we can see. Then we'll move on to palpating. We're going to palpate one carotid artery at a time. So here and over here. While we're palpating, we'll also palpate the thyroid. Good. Don't feel any goiters, nodules, anything like that. Well, best appreciate it from the back. So feel for the thyroid again. And can you swallow for me? Very good. All right. We're going to listen to the carotids using the bell. So just relax. We'll listen to the left side first. All right. And right side. Very good. Next thing we're going to do while we're looking at the neck is feel for the lymph nodes. So we'll start with preauricular. Okay, and then the post. Okay, move to the occipital behind the head. Good. The tonsillar, the submental, submandibular. Any pain when I palpate any of those, and I don't feel any hard nodules of any kind. Next, we'll go down the superficial cervical, and that's that. And we'll go to the posterior cervical. Any pain on those? And then we'll do the deep. So you can turn to your right, and deep cervical on the other side. Very good. And then we'll feel for the supraclavicular, right above here, and the infraclavicular. And while we're feeling for those, we'll have her extend her arms so we can feel for the axillary. Any pain on any of those? Okay. Okay. After that, we're going to move to extremities. So start again by inspection of the extremities. Look at the skin. Make sure it looks even. No wounds are of any kind. Go to the hands. You look for cap refill. So feel and just make sure the nails fill back up. Make sure there's no cracks or wounds of any kind. You feel all the joints. Make sure you don't feel any nodules. Any pain in the joints? Okay, and then you just kind of work your way up the arm here. Any pain? All the way up to the ulnar non-process, elbow, and the shoulder. Any pain?
No.
All right, and same thing on the other side. Any pain at all? Okay. While we're here, we'll also feel for pulses in the radial. 2+, and pulses in the brachial, also 2+. And then I'm going to do some deep tendon reflexes of the brachial. Over here, and straighten my finger, and this side. Okay. And we're going to work our way around to the back. We'll start by just inspecting the back. Going to make sure that the breathing is symmetrical, it's even, the skin looks good. Start by palpating the CVA down here. Okay, you find that. And then from there, you will make sure that her breathing is even, unlabored. There is no acute respiratory distress, nothing like that. You want to find the 10th rib, and then you will palpate for thoracic expansion. So take a deep breath for me. I'm going to make sure that's even. And then you'll also feel for tactile firmitus. So place hands on the back and have the patient say 99.
99. 99. 99.
Very good. And the last thing we'll do back here is look for diaphragmatic excursion. So you feel down, take a deep breath out, and hold it. Okay. And you percuss. Find where you feel the difference. Now do the opposite. Take a deep breath in and hold it. And right there, you feel the difference, and it's about 3 to 5 centimeters. So that's where you want it to fall. When we're percussing, you want to percuss the other 6 or so areas in the back. So to make sure you don't feel any hyperresonance or too much dullness. And then we'll move to listening to lung sounds. Take some deep breaths for me. Okay. One more. Good. Now we'll listen for lung sounds on the lateral side. And the other side. Okay. While we're listening to lung sounds, we'll go up to the front. Listen up front. Continue to just take deep breaths. Okay, very good. Sounds clear and equal throughout, no coarseness. So we're going to work our way to the anterior chest here. We're going to start by looking for symmetry. Going to make sure the rise is equal up front. And look at skin. Make sure, again, there's no wounds or anything like that. You're going to move on to looking for pulsations or heaving. So I don't see any of that. You want to make sure they're not struggling to take any breaths in. And then you're going to feel for crepitus on the front. Any pain when I? Okay. Next, you're going to feel for the pericardium. You're going to make sure there's no thrills or heaves or pulsations there. And you're going to feel for the apical impulse. So it's down here. You can also do the tactile fermentus on the front side. It's the same as we did on the back. Hold here and say 99.
99. 99. 99.
Very good. And then we will do our percussion as well. Okay. So everything sounded even throughout. Then we'll go ahead and listen for heart sounds. We'll start with the aortic area. And pulmonic. Work our way down. Okay, good. Now you can go ahead and lay back on the table and we'll start to get abdominal. Okay, so is it okay if I pull up your gown?
Yeah.
Okay, so when you start the abdominal exam, you just want to start with inspection. You're going to make sure there's no pulsations, waves. You're going to make sure the skin is even, there's no sores or wounds that you can see. Then you're going to, before you do anything else, you're going to auscultate. So I'm going to listen to all four quadrants, starting in the right lower. Okay, I can hear normal bowel sounds throughout. Next, I'll listen for arteries. We'll start with the aorta. We'll be using the bell. Okay, we'll move to renal. We'll move to iliac. And then we'll move to femoral. Okay. The next thing we'll do is we'll percuss. So we want to listen for tone. Okay, and then we want to percuss and find the liver border. So we start down by the umbilicus, the mid-clavicular line, work our way up. Okay, and then we'll start up here and work our way down. Very good. Next thing we're going to do is we're going to percuss for splenic dullness. You don't want to hear any dullness over the spleen area. I didn't hear any. Next thing we're going to do is we're going to move on to palpation. We'll start with light palpation by just feeling for any masses. Do you have any pain while I'm doing this?
No.
Okay, and then we'll move on to deep palpation. Again, any pain? Okay. The next deep palpating we'll do will be the right costal margin for the liver border. So you can take a deep breath for me. You can feel the liver there. And then we'll try and palpate the left costal margin for the spleen. And you don't want to be able to palpate that. Next we'll move on to palpating for the kidneys. Okay. And walk around the other side. The last thing I'm going to palpate for on the abdomen is the aorta. Just feel for any pulsation and feel any abdominal muscles. Okay, you can sit up. The next thing we're going to do is move down to the feet and the legs. So I'm just going to start by examining the legs. I want to make sure there would be any hair that would be evenly distributed. The skin looks good. There's no discoloration. Okay, and then I'm going to start palpating the legs. So I want to make sure that the temperature is okay. There's no hot areas. Any pain upon palpation. There's no swelling down on the feet or the ankles or the legs. The other side. And that the muscle mass is even throughout. Next thing I'm going to do is feel for the pulses in the legs. So we'll start by feeling for the popliteal pulse on the knee, the dorsalis pedis, top of the foot, and the posterior tibial. All good, all 2+. Next thing we're going to do is just test strength against resistance. So if you could push up for me. And back, and put your feet up, and pull them back. Very good. Last thing we'll do will be reflexes of the legs. All right, starting in here, just try and keep your leg relaxed. Okay, I'm going to come down here to the Achilles. Leg relax again. Very good. Our final thing we're going to look at for the exam today will be her cervical spine and her lumbar spine. The best way to do that is just have the patient stand up. So would stand up for me and face away. All right, so I have her bend over just a little bit. I'm going to start at C7 here and work my way down. Any pain?
No.
On palpation?
No.
All right, you can have a seat again. Thank you very much. That concludes my head-to-toe assessment.